My name is Alex. I'm a group head at the Florey Institute of Neuroscience and Mental Health, and I'm also a neurologist at Royal Melbourne Hospital and Eastern Health. Epilepsy is a very common neurological disorder, and it's characterized by symptoms of seizures and cognitive dysfunction, which are caused by abnormal activity within populations of neurons in the brain. About one-third of people with epilepsy are resistant to current forms of treatment. And so there's a huge need for a greater understanding of disease mechanisms, which is something that this project hopes to address. We've made huge progress in our understanding of epilepsy over the last 20 to 30 years, and we now have a much better understanding of the genetic and the molecular basis of epilepsy. But we still have a very limited understanding of how neural circuits in the brain change during the onset of epilepsy to produce symptoms of epilepsy, in particular seizures and other symptoms such as cognitive dysfunction. So, the purpose of this project, the goal of this project, is to use a technique called two-photon calcium imaging to record neural populations in models of epilepsy to understand how the brain changes during the onset of epilepsy and to gain a much deeper insight into the mechanisms of epilepsy and, in particular, epileptogenesis. I think the first impact is to really improve our understanding of basic mechanisms of epilepsy and epileptogenesis. I think this is an area that's been understudied and is still quite poorly understood. And the hope is that by understanding these mechanisms in more detail, this will allow us to identify targets for treatment, in particular cellular targets that can be treated. Another aspect of this study will be to look at the impact of anti-seizure medications and how these medications modify neural circuit activity to suppress seizures. And that will potentially give us insight into why some patients are undertreated and refractory to existing treatments.